So today, we're going to talk about a pretty fascinating weight loss drug called Orlistat. And you know, what makes it so interesting isn't just what it does, but really what it doesn't do. It takes a completely different path from almost every other weight loss medication you've heard of. Let's dive in.
So let me ask you this. When you think of a weight loss pill, what comes to mind? Probably something that helps you feel less hungry, right? Most of them work by messing with your brain chemistry to shut down your appetite. But what if there was a pill that could help you lose weight by completely ignoring your brain?
And right there, that's the fundamental difference. You see, your typical appetite suppressants, they're all about targeting the brain. Orlistat, it doesn't go anywhere near it. Its entire mission, the whole operation, takes place down in your gut, and it's only focused on one thing, stopping your body from absorbing fat. It's a totally different ballgame.
Yeah, this unique strategy really puts Orlistat in a league of its own. It's not about trying to trick your brain into thinking you're full. It's about physically changing how your body handles the food you just ate.
Okay, so the official technical term for what Orlistat is a lipase inhibitor. And what's so cool about this is just how simple the idea is. See, your body has these enzymes called lipases, and their job is to break down the fat you eat so you can absorb it. Orlistat's one and only purpose is to act like a bodyguard and just get in the way of those enzymes. So how does it actually pull that off? Well, this brings us to what I like to call the fat blockade mechanism. And it's a very direct, almost mechanical process that happens right inside your digestive system.
The whole thing is remarkably straightforward. First, it hones in on those lipase enzymes in your gut. Then, Orlistat literally latches onto them, basically flipping their off switch. Now, with those enzymes out of commission, the dietary fat you eat can't be broken down into small enough pieces to be absorbed. So, where does it go? Well, it has nowhere to go but straight on through and out of your body. And the effect here is pretty significant. We're talking about blocking roughly a quarter to a third, about 25 to 30% of the fat from every single meal you eat. Think about that. Those calories literally never even get a chance to enter your system. That is a sizable chunk.
Now here's a super important point. Orlistat is a specialist. It is laser-focused. It only goes after fat. Your body's ability to absorb and use all the good stuff from carbohydrates and proteins, totally untouched. So with a mechanism that powerful and specific, who is this drug actually for? And let's be really clear here, this is not for someone who wants to drop 5 pounds before a beach trip. This is a serious medical tool for very specific situations.
The medical guidelines are really strict. It's prescribed for adults with a body mass index, a BMI, of 30 or higher, which is the clinical threshold for obesity. Or it can be for people who are overweight with a BMI of 27 or more, but, and this is a big but, only if they also have other health risks hanging over their head, like high blood pressure or type 2 diabetes.
And this, right here, might be the most important rule of all. The pill is not a solo act. It only works, only works, when it's part of a bigger picture. That picture has to include a lower calorie diet, regular exercise, and genuine long-term changes to your habits.
Okay, so we have to talk about the consequences. Because when you stop nearly a third of the fat you eat from being absorbed, that fat has to go somewhere, right? And this leads to some, let's just say, unavoidable and very well-known side effects.
Honestly, this quote says it all. The best way to understand the side effects is to realize they aren't a bug, they're a feature. They are the direct, totally predictable result of the drug doing exactly what it's designed to do, blocking fat.
Yeah, they're often called treatment effects because they are a direct result of all that unabsorbed fat making its way through your system. And this can cause a whole range of pretty unpleasant gastrointestinal issues, from oily stools to a very sudden, very urgent needs to find a bathroom. It's just the physical reality of fat being passed instead of absorbed.
And here's the kicker. These effects are directly tied to what you eat. If you decide to have a greasy, high-fat meal while you're taking Orlistat, well, the side effects are going to be way, way worse. In a strange way, it's a powerful form of negative feedback. It creates this immediate physical link between eating the wrong food and having a really bad time. It's a tough teacher. Beyond the digestive drama, there are some really serious warnings. Because it blocks fat, it also messes with your ability to absorb critical fat-soluble vitamins. We're talking A, D, E, and K. That's why taking a daily multivitamin is non-negotiable, and you have to take it at least 2 hours apart from the Orlistat.
It can also interfere with crucial meds like blood thinners or anti-rejection drugs, and it's a definite no-go for people who already have conditions that affect nutrient absorption.
So when you put it all together, the unique way it works, the strict rules for who can take it, and those really challenging side effects, a very clear picture starts to form.
This really is the bottom line. Orlistat is a pharmacological tool. That's it. It can absolutely be effective, but its success is 100% tied to the user's commitment to that low-fat diet and a healthier lifestyle. You could say the pill helps you stick to the diet, and sticking to the diet makes taking the pill tolerable. They need each other.
It's also really important to have realistic expectations. When it's used the right way as part of that whole program, studies show Orlistat can help people lose, on average, about 5 to 10% of their starting body weight over a year. And that's a clinically meaningful amount. That can make a huge difference for your overall health.
And that's why, at the end of the day, patient education is everything. For this to have any chance of working, a person has to get it. They have to understand how it works, why that low-fat diet is an absolute must, how to manage the side effects, and why they can't skip their vitamins. Without that deep understanding, the whole thing is set up to fail.
Which leaves us with one final thought. Look, this is not an easy road. It demands real discipline and a willingness to put up with significant discomfort as a direct result of your food choices. So, when you consider the very real trade-offs, the balance between the benefits and the burdens, the big question is, who is this powerful, demanding tool truly right for?